Okay, actually, we're going to take questions now for our first three speakers. If there are any questions, there are microphones on both aisles. For any of the committee members that might have questions, please identify yourself and the speaker to which you want to pose a question. Anyone? I see some people moving, but nobody's standing up. I'm sorry, okay, can we have the speakers come and sit at the table? I didn't want to get them up here and no one's going to ask them a question. Here comes a helper.
This is for Ms. Herrick. You mentioned that for the NHANES sampling of the pregnant population, that one of the difficulties was that they're not eligible for certain components. Can you expand on what those components are?
Can you hear me? Is this on? Is that better? When a woman is pregnant, she's not eligible for things like the DEXA scan. There are other components that she might not be eligible for just based on her age, but it depends on what components are in the HANES MEC trailer. Questionnaires will always be administered, but because pregnant women in particular, represent a high-risk sample, we can't do a lot of study with them. Is there a particular component you're interested in?
No, I was just curious, other than the DEXA scan, are there other things that...
There may be other physical measurements that we probably wouldn't be interested in doing. You'd have to have a particular protocol, for example, if you were interested in waist and hip measurements, or maybe even skin folds. They have different things that you'd need to consider going forward with measurements.
Thank you. Anyone else? Other questions? I think we have one over here.
I'm Kathy Rasmussen, and I think the idea of imputing breast milk intake is fraught with terror. And I'm wondering how that is actually done and what you do with partial breastfeeding.
I can't see the light. Okay, sorry. The methodology we've used is what's published in the Feeding Infants and Toddlers survey, and the idea is just to put in a volume that makes sense based on the age of the infant and if they are also consuming formula. And while
that means you know the amount of formula consumed.
And we do that. We do that from the NHANES recall. We know the amount of formula that they've consumed. And I can provide specific information about how it's actually calculated. I can actually provide code to do that with NHANES as well. But it's a way to put in a volume that makes sense for the child's intake so that you can then use the nutrient values on breast milk from the database, put them in the full dietary recall, and create a total nutrients file. It is fraught with errors. I will give you that. They are old formulas that haven't changed, but with regards to breast milk, we have one value for breast milk in the database. And as we all are familiar.
We've noticed.
Yes.
We've noticed.
Yeah.
I didn't say fraught with error. I said fraught with terror.
Yes.
It's fraught with error also. You're not using the child's weight gain, length, any of that sort of stuff? You're picking a number out of what air?
Well, it's based on the child's, I can't remember the syntax right now, but it's based on the child's age and what they've already consumed. Okay. If you want to look at developing something that's based on the child's weight, that's certainly something that could be done.
Mm-hmm. Okay, thank you very much.
I had a quick question for Dr. Herrick. I was really interested in some of the data that you presented, and I don't know that I got it right, but it seemed when you were presenting slides on breastfeeding that almost twice as many infants were breastfeeding as mothers. Did I remember that correctly, and how is that possible?
Well, it's possible that the data is coming from a different questionnaire source. I can go back and look at it. But my recollection is that the information on breastfeeding status is coming from the food. For women breastfeeding, it's coming from the diet behavior questionnaire, and if they reported consuming any breast milk for children's dietary recall, that's coming from the actual 24-hour recall. So there could be a discrepancy there. But as well, you're not looking at the same women and children.
I'm so sorry, what did you say?
You're not looking at the same women and children. We don't necessarily capture a breastfeeding pair.
Okay.
So what happens in NHANES is we knock on the doorstep and we identify all of the respondents in the household, and understand that households can mean different things. You may have multiple generation households in one dwelling. And when you enumerate all the individuals in the household, our interviewers are in immediate contact with the census. And so we identify at the doorstep who in the household is eligible to be included to produce that nationally representative sample. So we don't always capture an infant and their mother.
So if we wanted to use your data to understand breastfeeding, should we use the infant data or the mother data?
What do you want to understand particularly?
Well, say the proportion of mothers that are breastfeeding, then we would use your breastfeeding mother. If we want to know the proportion of infants that are breastfeeding, then we use the breastfeeding, and those would be discordant. And just as somebody who has to massage data all the time, that would blow my mind. And I wouldn't know what sort of conclusion to draw.
I don't think we've looked at the discordance in the data that way. We could certainly look at it. When we report on breastfeeding, we look at the infants who reported breastfeeding based on the diet behavior questionnaire.
Thank you. Anybody else? Any other? Here's Kathy again.
Why not? You're here. This is the point. I have to remember my question now. The dietary guidelines are designed for individuals 2 to 70 or so?
2 and older.
Part
2 and older.
2 and older, so even 90-year-olds. Okay. But they don't speak specifically to pregnant women or lactating women.
Not yet. In 2020, with the Agricultural Act of 2014, that was a requirement. And actually, we had started a project, which you were involved in 2012, beginning to kind of scope this area. Particularly, we've initially focused on the birth to 24 months population, but have later expanded to address the women who are pregnant as well. So we're doing foundational work on that, and that will be a primary focus of the 2020 Dietary Guidelines.
Right, but it's my understanding that even that will still not cover breastfeeding women.
It will. Yep.
It will cover
Yep.
breastfeeding
We
women.
emailed you back, I think, yesterday or this morning around one of
Right.
the questions on that.
I got an email I did not understand, but I was
So-
very tired when I read it.
So we can talk again, but yes, it will. Yeah, I mean, we're planning to cover that,
The
spectrum. Yes.
entire
Yeah.
range. So in the meantime, how should we use the dietary guidelines in the context of serving a group of women who are pregnant and lactating? How should we interpret them?
Well, I think that, I mean, many of the recommendations around fruits and vegetables, I mean, we don't provide recommendations on additional calories to consume or that level, but I think the recommendations around a healthy diet, we've seen them apply. When our advisory committee did reviews on dietary patterns, for example, they didn't exclude pregnant women. There just wasn't a lot of evidence around that population. And so I think that the key elements apply. I'm sure that we'll have some more targeted guidance moving forward. I'll say that there has been some targeted guidance in the past around seafood, around different aspects of the diet, but we haven't done a comprehensive dietary guidelines for that population. So I mean, this is I know part of your role here. From our perspective, I think that we think that the key elements apply to women who are pregnant.
Okay, thank you.
Okay, anyone else? Suzanne? Sure, you can shout, can't she, Kathy? Feel right ahead.
Maybe you'll repeat my question. Are there plans to do longitudinal components?
So the question was, are there plans to do longitudinal components in NHANES? And the answer is yes. We are currently looking at making some parts of NHANES longitudinal, but at this stage, how that all comes into being, we don't know. It's still under development.
That'd be a great addition.
Could I just follow up on the breastfeeding question?
Certainly.
I was thinking about it a little more in terms of analysis. When you capture breastfeeding data for the women, you don't necessarily know the age of the child. When you're looking at breastfeeding, if a woman says she's breastfeeding, you may not know the age of the child that she's breastfeeding. So she could be fully breastfeeding in the early 6 months, or she could be partially breastfeeding later on. So I don't think we have, I think we have, if they're outside of 2 years, we don't know, I'm sure, but I'd have to go back and look at the exact questions. These are opportunities for changes to the NHANES questionnaires. As you might imagine, there are lots and lots and lots of questions that we have in NHANES, and it wasn't ever specifically designed to capture information on a very special group of individuals in the U.S. population. I certainly would love to have more data on them, but this is what we have as a national sample, and it provides a very large breadth of information on the whole United States, but we're not able to drill down very deeply on any one particular topic unless there are boost samples.
Okay, we have another question from Tamara.
Yeah, regarding the dietary guidelines, I was just wondering if you could give us a summary of the health outcomes that the guidelines were based on, and if the studies that were used to base those were equally divided with women and men, like were the samples for both genders, or was it heavier on the male side as typical?
So the health outcomes that were looked at traditionally, cardiovascular disease, type 2 diabetes, body weight and obesity, cancer. We did look at congenital anomalies, as well as neurological disorders, and there was a seventh one. Yeah, mental health. And so that next one all came to me. Oh, and bone health. And so in terms of the split, I would say that it was split. I mean, there were a fair number of studies on men and women. That wasn't necessarily a problem of not having women represented. I will say that there weren't, and I think I mentioned this, there weren't a lot of studies with children, and that is partly because of the outcomes that we have looked at. We've tried to pull in more outcomes. Children aren't going to necessarily develop cancer or the clinical hard outcomes. And so there is some work to refine some of the outcomes. The bone health outcome, for example, would be one where we would expect to see a little bit more evidence on children. But in general, the bulk of the evidence is still around with adults. But I wouldn't say that it's disproportionately, more men represented than women. But I could provide more details on that, but that's not something that we found overall.
Hi, Nikki Ford with the Hass Avocado Board. I'm thinking about the 2020.
I'm sorry, the questions are limited to committee members.
Oh, I'm sorry.
That's
Okay.
okay, sorry. Any committee members have questions? You can talk to them outside in the hall, that's okay. All right. If we have no more questions, let me thank the speakers for great presentations this morning. And we're going to take a 15-minute break, maybe a little bit more. It's about 10:30. Can we reconvene at 10:45? Thank you.